Welcome back to 12 to Your Health. I'm Dr. Derek Da Silva. We all have aches and pains from time to time, but the problem is when we get them treated, too much focus is put on the symptoms and not on the underlying cause of the pain. A relatively new approach to pain and weakness is called muscle activation techniques, or MAT. Here to show us how it works is Ken Freiberg, a muscle activation technique specialist and owner of Neuromuscular Restoration in Ridgefield. We're also joined by Laura, who's going to be our patient and or our guinea pig today. So, hey, welcome to the program.
Thank you.
What is muscle activation techniques?
MAT, muscle activation techniques, was put together by a gentleman by the name of Greg Roscoff. He's the head biomechanics consultant for the Utah Jazz, the Denver Nuggets. He's based out of Denver, Colorado. And he put this system together about 10, 12 years ago. Basically, what it does, we address muscle tightness as the form of muscle weakness.
So I know that there are other techniques like muscle. I know that there's another one that we had demonstration called ART. What is the difference between the two? And what is ART?
Active release techniques is done by chiropractors primarily, and what they do is they believe that muscles have issues and they don't have proper nerve flow because the nerves are entrapped by scar tissue, which is very valid and great. So what they do is they get in there and they will release the scar tissue, thus allowing the nerves to flow more freely. The difference, what we do with MAT, again, we believe that muscle tightness is secondary to muscle weakness. We go in and we do range of motion assessments to determine specifically where the patient has limited range of motion. Based off of that, we'll do very specific muscle testing to see which muscles are weak. We activate the weak muscles, make them stronger, and then the tight muscles automatically relax all by themselves, allowing the body to heal itself.
You know what, the beauty of the body is that, and I tell people this all the time, it isn't a liver, a kidney, a brain, and a spleen. Everything, if one area is not working correctly, it is going to impact another area. I mean, could you just comment on that and help us understand that better?
Well, yeah, the body, it's holistic. It's the way that you look at the body is exactly what you said. Specialists will look at, a hip specialist will look at the hip like this. A foot specialist will look at the foot like this, but they don't see sometimes the connection of how the whole body works. When we're standing, there's obvious ground forces to go from the ankle to the knee to the hip to the spine to the shoulder blade to the neck. A neck issue could be something happening down in the ankle.
And I think that's the thing that people really don't understand, that people I think have to begin to understand. Who's the best candidate for this technique that you're talking to us about?
Well, I've personally treated kids 11, 12 years old up into all the way up to 97 years old. It's really for anyone that has any type of limited range of motion, tightness, weakness, or muscular pain or dysfunction.
So if somebody has back pain, is this something that you would look at?
Actually, lower back issues is something I like to help people with. I myself have had pre-existing back issues, so I made that sort of my my mission to help people.
All right. So, you know, this nice lady has just volunteered to lay here on the table. Let's do something with her. Can you show us what you do?
Sure.
And tell us what you're assessing, if you will.
Well, Laura has been a patient of mine for about 5-6 months or so, maybe a little longer, and she came to me from an osteopath in New York City. He did a lot of things with her and then referred her out to me to help get the muscles firing back up. So what we would traditionally start with is checking out range of motion in the hips, and it's very simple.
Now, what is she complaining of now? Is she complaining of back pain? What is her complaint?
She has a...
or is this just a general assessment?
Specifically for Laura, she has a multitude of issues that we're dealing with. From the hip to the lower back to the mid back. She was in a car accident, actually. But when we do our assessments, we're looking for bilateral differences between right and left with how far she can go. Based off those findings, we then zoom in and start doing very specific muscle testing to see which muscles aren't working.
Go ahead.
So something very simple, we would bring the leg out here, internally rotate, and start comparing. And so far, so good. You actually feel pretty good today, Laura.
So. What you're just assessing here, range of motion, how everything is, and everything is, if you said, Will, symmetrical, meaning they're equal on both sides.
Exactly. If I went to this side and I turned this leg in and only went that far.
I see.
And on this side, if I turn this leg in and went all the way,
Okay.
I'd say, okay, there's something going on with this hip. We do range of motion assessments for every part of the body. Foot, knee, ankle, every part of the body. I'm just, for demonstration purposes, showing the hip at this point.
Okay, so let's say that ankle, that technique that you just did, just rotated just a slight bit. What would you do? How would you fix it?
Well, once I'm out here, if I did internal rotation, I'd say, okay, we have some type of limitation with the hip. I'll then start testing muscles responsible for that movement. So if I did a muscle test with you, Laura, ready? Yeah. Resist. That muscle tests nice and strong. She's pushing out against me. I'm trying to push her in. Ready? Resist. That's weak.
Okay.
Let's compare that to this side. Ready? Resist. That's strong. So now I'm looking at this as her gluteus minimus, her anterior fibers. Those are the muscles that are actually shut down. I would go in and I would activate them.
How do you do that?
Either with isometrics, where she would press against my hand in a very special position to try and get those muscles firing back up, or I would sink and go right into the tendinous attachments to where the muscle meets the bone, because that's where a majority of the nerves and the information goes back up to the brain. We're basically reminding the brain, hey, listen, this muscle isn't working, let's get it working. If I did that treatment, and for time purposes we won't, but if I did the treatment and we went back, and then I went
and you would see something like that immediately?
It's immediate.
You would see a response to me. And then how would she continue to do that? Would she continue to see you? Do you give her exercises at home? How does that happen?
Both, really. The treatments would be ongoing until she's pain-free and her range of motion has been restored. Her flexibility, basically, in a joint has been restored.
I see.
And then there are corrective exercises as well that we'll recommend for them to do at home, which are basically isometrics, which eventually carry on into the gym or your sport of choice.
All right. So what do you, I mean, if it's in the upper body, you go through the same technique and the same thing that you just did in the lower body?
The very first assessment is pretty long. It's over an hour long. And I'll do a range of motion assessment throughout the entire body. If they come to us talking about how it's a neck issue, I'll still start the ankles and work my way up to get a full body scan to see what's going on.
Super. Thank you so much for being here.
Thank you very much.
And Laura, thank you for being such a wonderful guinea pig.
Oh, you're welcome.
Appreciate you being
Laura.
here. Folks, stay with us. When we come back, I'll answer your email questions and weigh in on a new warning about vitamin D. But first, here's a look at this week's Community Health Calendar.